Today we're showing Harry, the rescued great horned owl, under general anesthesia for debridement of a very large necrotic oral lesion from trichomoniasis. This lesion is so large it's obstructing his ability to eat and swallow food. The necrotic tissue continues to build up as he heals from underneath this lesion. Here we're debriding or removing the surface of the lesion. We cannot remove the full lesion as it still has a vascular or blood supply where it's attached to healthy tissue, which would result in hemorrhage. So we're trying to debulk or reduce the size of the oral lesion to allow him to ingest food more easily. Currently, we are tube feeding him a liquid diet in order to bypass this lesion. And the goal is to be able to get him on small pieces of meat once again. He's doing well overall. He's very bright and alert. He's stronger every day and very responsive. But this is a very severe infection of trichomoniasis and often a fatal disease in these wild animals, very common in raptors in general. On this view, we're looking at the upper part of his mouth or his palate. And as you can see, this necrotic or dead tissue is filling the entire upper palate and is all the way down to the airway where you see the actual tube in his airway or trachea. It's not actually obstructing the airway, but certainly obstructing his throat and his ability to swallow. We're very carefully trying to debride just the dead tissue without any vascular supply. And this tissue is very friable, meaning it fragments into multiple little pieces and is very difficult to remove. And we have to remove it at a small section because we can't see the underlying blood vessels. So we're just gently trying to trim it down and go further and deeper, removing what we feel is safe at this point. He will have more than likely an additional follow-up procedure where we remove more of this. As the underlying tissue heals, this lesion will eventually slough off and they either swallow it or spit it out. He does have the ability to heal fully from this with very intensive supportive care. Hydration is important for these owls, as well as nutrition, as he certainly cannot eat on his own. Here we're using the end of a blade holder. You can see the red and blue tag just marking the instruments on the end of it, and we're just gently lifting it to see where it is not attached to the underlying tissue, so we know what we can safely trim away here. Trichomoniasis is caused by the parasite Trichomonas gallinae. It primarily affects birds and can be deadly to wild owls. Owls become infected by eating birds, especially doves and pigeons that carry the parasite. The parasite lives in the mouth and crop of infected prey and is passed on to the owl when consumed. Signs of infection in owls are difficulty swallowing or breathing, weight loss, weakness, sudden death, white or yellow plaques in the mouth and throat, regurgitated or undigested food. We also saw copious nasal discharge and ocular discharge in Harry. Trichomoniasis can cause fatal throat and mouth infection in owls. It is especially common in great horned owls and other raptors that hunt doves and pigeons, thus more common in urban areas. Treatment via licensed rehabilitators is long, complicated, and involved for these owls and involves metronidazole, carnidazole, and intensive supportive care, including fluids, antibiotics, anti-inflammatories, and feeding.